that this teen's car was discharged from the hospital in the area, so there's another serious HIPAA problem there. He had been posing as a physician at that facility as well, evidently. As we said, the mom refused, at least he says to the mom, he refused to take his medication. Emily, I've never heard of anything quite like this myself, but I do know that it can get confusing to healthcare providers when there are lots of observers around, as there can be in teaching hospitals, and there needs to be.
Yeah, and as a patient, though, you have the right to ask or to refuse care from that doctor. You also have the right to see what they may not have a diploma at a teaching hospital, but if you were in private practice, you'd have a diploma or some sort of licensure. And as a patient, you have a cell phone. You can Google these doctors. There is information out there that makes you a very active consumer, especially if your doctor looks like Doogie Howser. I would ask you to question that.
Emily, I'm going to interrupt you because a tweet has shown up right alongside of you there. It says the St. Mary's Hospital in West Palm Beach, Florida is not a teaching hospital. I work there allegedly. This Kelly Drake who's tweeting us here, and that's kind of interesting. Then who would these observers be? Why would they be there? What's going on?
You know, Dr. Drew,
yeah.
If this raises a red flag about anything, it is the lack of security at most hospitals in America. They're very public. They're open doors. You can almost wander around the wards, and these vulnerable patients, many of them on medication, many of them sleeping and under sedation, that almost anybody from the street can find.
I'm not sure that's true in most hospitals. I mean, I've worked in a lot of hospitals, and the security was really I didn't feel as though somebody could just walk in. Though you're right, though. I suppose if somebody was super motivated, they could.
This kid sure did.
Yeah, that's right. Here's some